So as Sadia mentioned, I worked on this particular qualitative research study as a postdoc. And the senior author, if anyone had a chance to kind of skim through the article, is Dr. Campbell. He was busy today, so he could not make it. And unfortunately, our patient partners are so busy with all the work that they do. Sandra and Nancy could not be here today either because they have other commitments. So I'm here, and hopefully I'll provide a summary of the article and talk a little bit about how we kind of undertook patient engagement in terms of the study. I know Sadia already provided a land acknowledgement, but again, our team in terms of Dr. Campbell and I were situated at the University of Calgary, located in the heart of southern Alberta, and the U of C both acknowledges and pays tribute to the traditional territories of the peoples of Treaty 7, which include the Blackfoot Confederacy, the Tsuut'ina First Nation, and the Stoney Nakoda, and our city is also home to the Métis Nation of Alberta, Districts 5 and 6. So our article was actually published earlier this year in Health Expectations. And so when we went to publish it, something kind of interesting that I noticed, which I haven't noticed, I guess, as a grad student and as a postdoc, is this. When I went to the About Us page for this journal, and maybe their description of the journal's changed now over the last few months, but they seem to emphasize at that time when we kind of selected this journal, patient engagement and patient-oriented research. And when we went to submit this paper, they actually had us write up a blurb about patient or public contribution in the abstract. And that was kind of interesting because as a trainee and as a grad student, I've never really come across a journal that explicitly asked for that. So that was kind of something interesting, and it stuck out to us when we selected this particular journal. What you see in blue are our names of the people that were involved, so our team, and we're all affiliated with the University of Calgary and the University of Alberta through medicine, but we all actually bring in different backgrounds as well. And obviously our patient partners bring in their expertise as well. So we had, representation from pharmacy and nursing and primary care, nephrology, endocrinology. And so it's a fairly diverse team. And this qualitative study is actually one of many sub-studies. We have a few other sub-studies that were kind of ongoing at the same time as we were undertaking this qualitative work, because kind of our overarching umbrella is that the team has been trying to create this intervention for patients so they can kind of manage sick days, in terms of their medications. And so this was just one sub-study. We also had a scoping review published about this topic of sick day guidance and sick day management. And then we also undertook like a international Delphi panel study, and that's been published as well. But again, today I'll talk about this particular qualitative work that we did, and all these, sub-studies, as I call them, have informed or have been informing that larger project of creating that particular intervention. So as Sadia had requested that, I quickly provide a summary of the article. And so again, if anyone's reviewed this article, I'm pulling straight from, the abstract, a quick little summary. So, people with chronic health conditions often take medications that improve, long-term outcomes. It helps them manage their condition, but sometimes these meds can also be harmful during acute illness. There's a little bit of work out there that's been published that says, for example, if a patient is living with a particular chronic condition and, they're experiencing acute illness, maybe due to something, due to influenza or some sort of gastrointestinal issue that all of a sudden came about, those same medications that usually help them with their condition can cause potential complications. And so, out there in like the public domain, there are some guidelines. For example, Diabetes Canada has resources for people living with diabetes of, hey, if you're experiencing an acute illness, there's vomiting happening, you're losing kind of body fluids and sweating, and like stop these particular medications, temporarily before you're feeling better again and you're back to eating and drinking normally. So that's kind of like the literature out there. When we actually did our scoping review, we only found a few number of small qualitative studies existing that about this topic. And from what I recall, those 3 or 4 papers, they none of them were from Canada, and they were all focused on, like, a particular intervention. For example, one was a telephone support program for people that were experiencing acute illness. Of course, they're living with a particular chronic health condition, and all of a sudden they needed help. They could pick up the phone and connect with a healthcare provider. But in Canada, again, very, very little research from what I recall, none of those couple of those studies were from Canada. So we decided, okay, why don't we try to learn not about a particular intervention, because we're not at the stage of, again, we're working on trying to create one, but let's just try to understand what people do when they're acutely ill, and then what do the providers do to support these people. So as a result, we ended up at our study objective, and this is the objective that you'll see in the article as well. So again, quickly, in terms of methods, we used a qualitative description approach. We purposefully sampled. We wanted to try to recruit people, again, that are living with a particular chronic health condition, that can talk about and share their experiences of what they do when they're acutely ill. And of course, we had healthcare providers that we wanted to recruit as well. So for example, family doctors working in the community, what kind of experiences do they have in terms of delivering sick day guidance? We undertook data collection virtually, so we did focus groups and interviews over the phone. And then, of course, we had approach to analyze our data to come up with some themes. And so we had in total 48 participants, 20 patients and 28 healthcare providers. In terms of our healthcare providers, we had a couple of nurse practitioners, and then we had pharmacists and primary care physicians. We ended up with 3 themes, right? Suggesting a broad spectrum and approaches to managing sick days. And again, I'll tap into these themes a little bit quickly. So in terms of individualized communication, we found that both patients and providers described how their individual circumstances determine kind of that need and modality for communication about sick days. So from the patient perspective, they often ended up communicating with their healthcare providers depending on the severity of their acute illness, right? So they kind of assessed their own signs and symptoms and determined if they wanted to essentially reach out to a healthcare provider. And I remember if you said, of course, this acute illness, it always happens like 1 a.m. in the morning when, your family doctor's office is closed, you can't reach your pharmacist, etc. In terms of the healthcare providers, when they talked about communication, they actually didn't bring up or talk about any sort of communication issues in terms of sick day guidance with their patients. A lot of the professionals immediately started talking about, their communication challenges with each other as providers, right? Pharmacists would speak of, okay, we worked with this patient and we ended up changing a medication and we sent that information off to the primary care physician, but yet we never heard back. So, they reported challenges in communication with each other. In terms of sick day practices, like actually what people were doing. So in terms of the patients, they reported having the knowledge to kind of self-identify that they were feeling acutely ill and they were having symptoms such as like vomiting or, diarrhea, etc. And they kind of, based on, that, they would then take certain actions, right? So if they felt like they were getting dehydrated, right, they knew to, okay, I need to kind of increase my fluid intake, I need to drink some more water, etc. And then in terms of healthcare providers' practices, i.e. when it came to the delivery of sick day guidance, that was solely based on their work context. So, our healthcare providers said, okay, my sick day guidance practices are pretty much based on my workload. There's so many other issues and concerns that I'm trying to deal with. So, unless a patient comes to me at that time and they're acutely ill at that time, yes, we'll, take the necessary actions. But oftentimes, if it's, another maybe follow-up appointment or something, we rarely, for example, pull out the, Diabetes Canada resource on sick day management and then talk about this proactively. And again, a lot of them said, we've been so busy, especially during the pandemic, sometimes this whole idea of sick day guidance takes kind of a really low priority in their practice. And in terms of knowledge of sick day practices and relevant resources, so a lot of, most of the patients said they were knowledgeable about why they were prescribed certain medications, but some were less clear in terms of like the medications in relation to the sick day management and sick day guidance piece. So for some patients were knowledgeable, though, on the flip side, they said, you know what, I remember when I was diagnosed, I was given this Diabetes Canada resource, and now if I'm, experiencing a sick day, I'm acutely ill, like I can use this Diabetes Canada handout. It tells me what I need to potentially temporarily stop. And then, of course, there was always the desire for more information. When it came to the healthcare providers, a lot of the providers were actually knowledgeable about that Diabetes Canada resource. Most of them said, yeah, when it comes to diabetes, we know this resource exists, and they ended up using it. Some people and some healthcare providers, on the other hand, were unaware of these types of resources or just chose not to use them. And overall, the healthcare providers kind of voiced that their levels of confidence about sick day guidance and knowledge varied. Some said, yeah, I remember covering this topic maybe a little bit during medical school, but then now I'm out in the real world and practicing, and I've never really it doesn't really come up, or in their practice, or they've they don't they didn't take like any advanced course. It was something that they touched on in medical school, and it's never really then been a priority for them in their practice. And so ultimately, we concluded that it's important to understand the perspectives of patients and providers, especially if you're trying to create some sort of intervention. And so that's how we kind of concluded our paper. And here's the blurb, the patient or public contribution blurb, right? So Health Expectations wanted a very brief, some brief details about, how we went about engaging patient partners, etc., patients as study participants. So, we offered that brief detail in the abstract as well. So when Sadia invited us, we kind of threw it back, and I went back to the CIHR website and looked up, how has kind of patient-oriented research and this particular idea and the idea of patient engagement, how has it really evolved, kind of across Canada? And I started like pulling up definitions. So this particular definition is from here, our local Alberta SPORU website, and it's fairly similar to the CIHR definition of patient-oriented research, right? So this research engages patients, it focuses on patient-identified topics, and so on and so forth. And same with patient engagement. Again, from Alberta SPORU website, they've defined it as meaningful and active collaboration of patients in any or all phases of research. And the second bullet point actually came across the CIHR website when I was kind of, reviewing of how far we've come in Canada with these topics. And on one of the web pages, it said this type of participation helps ensure that the research being conducted is relevant and valuable to the patients, which is important. Why create a intervention if ultimately it's not going to be relevant and valuable to the people that providers care for? You'll find the CIHR figure that they've created, and they've pretty much shown, you look at this kind of cyclical figure, and it shows where people or where patient partners can be involved. And so looking at that, I started to think about those green boxes and said, okay, so where were our patient partners involved, right? So in terms of the research proposal, our patient partners provided feedback when, we were developing the research proposal for this particular qualitative project. In terms of oversight of the research project, we've had our patient partners involved, and they attend the weekly team meetings via Zoom, and that's still ongoing, not just for this project, but still. As I kind of moved on for the fellowship, it was just routine to have these weekly meetings. And because we had different sub-studies going on, like this qualitative and then study, and then like, for example, a scoping review, we had like smaller working group meetings, and they would be there as well. They were fairly instrumental in terms of recruitment. So they helped us design recruitment materials. They helped us advertise the study, right, when we were trying to recruit. They made suggestions of how and where we could undertake recruitment, and that was really important. In terms of data collection, not only did they help us develop and revise the interview guides, but our patient partners actually conducted data collection. So they were there during their focus groups and interviews and actually asking questions. When our study participants were, like live with us virtually or over the phone, our patient partners also asked questions. So that was really good, right? Because they could bring in their expertise and ask questions that maybe, we forgot to put on the interview guide, or just based on how the interviews were going, there were things that were coming up and they were openly asking questions. In terms of our data analysis, so we had like a bunch of people involved in data analysis in terms of the team members. And so we, as team members, started conducting our analysis, and of course, our patient partners being also team members, they would review what we were kind of, coming up with in terms of themes and that. And so that was really important as well. I think there's probably more ways patient partners could be involved in analysis as well. But as we started to kind of, as our, themes started to emerge and stuff, we would go back to them and ask them feedback, or if we were presenting kind of what was emerging in team meetings, again, ask for feedback about those emerging themes. And then in terms of knowledge dissemination, also being, again, one of those green boxes in that figure, our patient partners helped us develop conference presentations. They were all co-authors on the conference presentations. They helped us with the development of this particular manuscript that got published in Health Expectations. From what I recall, I think one of them even presented our work at an event as well with another team member. And so, and I'm starting to come across that more and more, where patient partners are actually really actively involved in this knowledge dissemination piece as well. And when we were, again, I was just reviewing things on the website, on the CIHR website. I came across these core competencies for patient-oriented research, and I believe they were in the 2015 capacity development framework that CIHR had published. And I was kind of reading those core competencies, and it said something along the lines of, these are some core competencies that research teams and patient partners, everybody can work together to kind of create that really nice culture for patient engagement and whatnot. And reading those core competencies, communication and collaboration really stuck out a lot. So again, we were thinking about, okay, how did we go about communicating, again, for this particular study, right? In our meetings, we're trying to use language that is understood by all. We want to make sure that everybody's comfortable in speaking up during the meetings. It's not just, the PI or the primary investigator or the, and everyone else is sitting quiet, being open and actively listening to everybody's opinions, and respecting each other's opinions and thoughts and ideas. Because of the pandemic, I think everyone's, work in the last couple of years has been affected. And so we tried to collaborate as best as we could. Sometimes people used to be in the office, sometimes people used to be working from home. So we tried to use technology as the best as we could to, again, foster that collaboration and work together as best as we could. And of course, having a common goal, I think that helps, right? When we all have a common goal as a team and we know what we're working towards too, that can help with collaboration as well. So these were some of the things that we did in terms of patient-oriented research and in terms of patient engagement. And again, it would have been nice if my other teammates were here today. They could probably even speak to it more from their personal experiences of being patient partners. And that's all I have in terms of my quick presentation.